All right, how's it going, everybody? Welcome to the Implant Prosthodontics YouTube channel. Dr. Derek Gatta here, your host. I'm very excited to be back talking about what parts do I need for all-on-4 cases. I get this question a lot, and I want to try and help everybody out, provide some value, and demystify this process here. So, again, all-on-4 process, you're looking at multiple implants, restoring a whole arch, most likely. This company here is 3i, could be any company, it's just what I happen to use here. I like having options, so these are your low profile abutments. These are the components that actually screw into the implants. Now with multiple implant restorations, I like working at tissue level. That way it's a little more comfortable for the patient because it's easier to take on and off. You're not going at the bone level right into the implant. You're going up higher, tissue level, more comfortable for the patient, gives you some more room, a little less bloody. And with all that tissue thickness, you got to think tissue thicknesses come in different sizes. So for thin tissue, we got 2 millimeter height, and for thicker tissue, we got 4 millimeter height. So it just gives you some options. And again, they sell these in hexed, non-hexed. I like using hexed for my low profile abutment. I just don't really see a reason to use non-hexed. But once you start working above this platform, everything has to be non-hexed because it's got to draw on and off your model here. All right, retaining screw. You're going to be using the low profile abutment gold tight retaining screw. Again, keep an eye out for your part number. I've been burned several times on ordering the wrong parts. They have a lot of screws in the catalog, and I ordered some that didn't even fit, so I couldn't use them. That was pretty frustrating. Thank you, 3i. Also, pay attention to your torque. 10 Newton centimeters, that's the max torque allowed for these tiny prosthetic screws for all-on-4 style restorations. Next part you're going to need analogs. This is your low profile abutment lab analog. This simulates what the implant's going to look like in your cast. So once you have your impression, you'll screw these into the impression copings through your impression. And I recommend ordering twice as many as what you need. So let's say you're using 10 implants for a case, order 20 of these. That way you can make a check cast. So if your temporary hybrid ever breaks, you have another just a little lab putty with these analogs in it to help make repairs. You don't have to do the repair right in the patient's mouth if your master cast is already sent away to the lab. This part is pretty helpful. Low profile abutment distal extension. So this is just a little ring with a metal extender that's going to slide over your temporary cylinder and basically just helps minimize your cantilever, because usually these temporary hybrid restorations break right around the first molar area or whatever is distal to your last implant. So this helps minimize that cantilever length. Very helpful little part. So you're going to need 2 of these per arch, right? So one's going to go on the most distal implant on each left and right side of each arch. So 2 per arch and 4 per whole mouth. All right, next you're going to need the low profile abutment non-hexed pickup impression coping. I like doing pickup open tray impressions, and that's what this is for. So again, this will be sticking through your impression, cut holes in your tray. And again, it's non-hexed, remember, because we're using, well, the top, if you can envision this, the top of your low profile abutment is non-hexed because we're doing a multi-implant restoration. Everything has to draw passively. So above those components are all non-hexed. And this impression coping is non-hexed. Make sure you buy the right one. Temporary cylinders. This is what you're going to use to actually do the all-on-4 pickup conversion in the OR or several months after integration. Low profile abutment non-hexed temporary cylinder. Again, important to buy non-hexed. Everything has to draw passively. You can see there's no indexing features inside there. And these little guys are pretty helpful. Your low profile abutment healing caps. So basically, once your surgeon has the implants in place, next, the low profile abutment is going to be torqued in place. And these healing caps go on top of that, and they just give your surgeon a little marker of what to suture around. So your surgeon could be suturing around these healing caps, and then when the patient is transferred to your room for the prosthetics, you take these off and you do your all-in-4 pickup in your room, if that's how you choose to do it. So again, these are the most commonly used parts here for all-in-4 conversions. I hope you guys found this helpful. Again, feel free to email me, contact me, follow me on social media. Would love to keep providing helpful videos for you guys and give you some topics and ideas for more videos. Hey, you guys take care. Enjoy.